Hi, my name is Cheyenne and today I'm going to be showing you the BE trigger. First, I'm just going to go over a list of supplies we have. I have lead to protect the patient. I have a patient gown, towels, sheet, chucks, just in case we're needed. Then over here I have our barium bag. It comes in a sterile container. It comes with a tip, an inflator, and a balloon inflator. First, I'm going to make sure that I don't have it more than 24 inches above the patient. I'm going to fill up and test the balloon to make sure it works. Make sure that the air goes through. Then on my table I have gloves, extra clamps in case we need them, tape, KY jelly for the tip, and liquid pole bar barium. I'm Cheyenne and I'm going to be assisting with your BE today.
Okay.
Can I have you verify your first and your last name for me?
Haley Moore,
And your birthday?
8/20/95.
Okay. And because you are female, I do have to ask, is there any chance that you could be pregnant?
No.
Okay. Can you tell me a little bit about what's been going on with you lately?
So I've been having abdominal pain for about 2 months and then recent blood in the stool.
Okay. Have you ever had a BE before?
No.
Okay. Has anybody explained this procedure to you?
Yes, my primary care physician has.
Okay, perfect. And have you had any recent surgeries to your abdominal area?
No.
No? Okay, perfect. I'm going to go ahead and have you put this gown on. I'll need everything off. Go ahead and put that gown on with the opening in the back. Now that my room is all set up, I went ahead and had the patient come out, and I'm going to shoot an AP scout to send to the radiologist to double check and make sure that the patient is all cleared out and ready for the BE exam. For this x-ray, my central ray is going to be at the level of the iliac crest and centered at the mid-sagittal plane. I go ahead and make sure that my IR is lined up and shoot the x-ray on a full expiration. Now that I've received the all clear from the radiologist, I'm going to go ahead and begin tipping the patient for the barium enema. I have the patient currently in the Sims position. I have my barium-filled bag here. I'm going to go ahead and bleed the line to get the barium to the tip so that way there's minimal air in the line. Once the line is bled, I will clamp it off to ensure that no barium spills out during tipping. I'm going to insert the tip 1 inch anteriorly and no more than 3 inches superiorly, making sure I don't pass the rivet on the tip. I'm going to go ahead and lube it up for easy insertion for the patient. And I have this sheet over the patient for modesty. Now, Ms. Moorhart, I'm going to have you go ahead and take some nice deep breaths for me. Try to prevent the urge of clenching down. And go ahead and I'm going to insert. Now I'm going to tape the line to the patient's leg to ensure that it stays in place while we're moving the patient. And then I'm going to insert 1 pump of air into the balloon to ensure the tip is safely secure in the patient. Then I will go ahead and clamp it off to make sure that the balloon stays in place. Now that I've tipped the patient, I'm going to go ahead and call the radiologist so we can start with the BE. Now, after performing the fluoro images with the radiologist, we're going to go ahead and take some overhead views of the patient. I'm going to go ahead and lower the barium bag down onto the table for patient comfort. And now we'll go ahead and get started. Okay, for the first view, I'm going to be doing an AP lateral recumbent view. I'm going to make sure that my central ray is perpendicular to the IR and centered at the mid-sagittal plane in the iliac crest. And I have my left marker marking the upside. Go ahead and hold your breath. I did this exposure at a technique of 100 kVp at 25. Next, I'm going to have the patient in an RAO position. I'm going to have the patient rotate 35 to 45 degrees for me. I'm going to have you roll up onto your right side, bring your left arm up, slightly bend this leg, perfect. And then I'm going to line my tube back up. Make sure that I'm detented. My central ray for this one is going to be 1 to 2 inches laterally from the elevated side and at the level of the iliac crest. I'm going to make sure that my tube is lined up, and I will do this on an expiration. Go ahead and take a deep breath in, let it out, X-ray. I use the technique of 110 kVp at 30 max. Next, we're going to do the PA view. For this one, I'm going to be centering my central ray at the level of the iliac crest and at the mid-sagittal plane. I'm going to make sure my tube is detented and lined up with my bucky. I'm going to go ahead and place my left marker on the cassette. Going to feel around and make sure I'm positioned in the right spot. I'm going to shield the patient. And then I'm going to go ahead and make the exposure. Go ahead and stop breathing. Beep. X-ray. For this view, I use a technique of 110 kVp at 25 max. Now I'm going to do the PA axial view. For this view, I'm going to add a 35-degree angle on my tube. This angle can range anywhere from 30 to 40 degrees depending on your patient. My central ray is going to be at the mid-sagittal plane and at the level of the as-is. I'm going to make sure that my bucky and my tube are lined up together. Make sure my patient is shielded. X-ray, hold your breath. You can breathe. And I shot this with a technique of 100 kVp at 25 max. Now I'm going to have you go ahead and get in the LAO position. I'm going to have you turn up onto your side. I'm going to take the angle off my tube. I'm going to realign it towards the patient. This one's going to be centered 1 to 2 inches laterally from to the elevated side and at the level of the iliac crest. Make sure my bucky is aligned with my tube. And I'm going to do this on suspended breathing. Okay, Miss Morehart, go ahead and hold your breath. X-ray. I did this scalp view at a technique of 110 kVp with a 30 max. How are you doing, Mrs. Morehart? Do a lateral rectum shot. I'm going to go ahead and have the patient lay on their left side in the lateral position. Okay, Miss Morehart, I'm going to have you turn and lay on your left side for me. Yep, go ahead and bend those legs. Now for this view, I'm going to be centered at the level of the as-is and the mid-coronal plane, midway between the as-is and the posterior sacrum. And I'm going to make sure that my tube and my bucky are lined. I'm going to collimate in. And then I'm just going to have you go ahead and hold your breath for me. X-ray. You can breathe. For this shot, I used a technique of 100 kVp at 50 max. Now that I've completed the rectum shot, I'm going to go ahead and do the left lateral decubitus. Okay, left lateral. I'm going to make sure that I am 40 inches away. Move my shoe. My central ray is going to be perpendicular to the IR plate. I'm going to make sure that I'm centered at the mid-sagittal plane and at the level of the iliac crest. Going to have you roll up, get as close as you can to that board. I'm just going to make sure that the patient is nice and stacked on top of it on herself. Patient shielded. And I'm going to put a right marker to mark the right side up. Go ahead and stop breathing. X-ray. You can breathe. And I did that view with a technique of 100 kVp at 25 max. Now that I've finished all the overhead images, I'm going to go ahead and move the tube out of the way, and I'm going to untip the patient. I'll start by removing my shield. And then I'm going to deflate the balloon, and then I will have the patient, I will untip the patient, and then I will have them escorted to the restroom right away. So Ms. Moorhart, I'm going to go ahead and take the tip out. Go ahead and just breathe slowly, and I'm going to go ahead and release that balloon. Keep breathing nice and slowly. You're doing a good job. Then I would escort the patient to the bathroom. Once the patient has fully evacuated all the barium that they can, I will go ahead and do one more scout image of a post-evac for the doctor to view.